Nancy, nice to have you here.
Well, actually, it was Christine who said it to me.
Christine, thank you. Okay,
So is this the one?
are we on?
Yes, we're,
Okay.
yes, we're on.
Hello, parents. Thank you for joining us for our fourth parent forum. This is the last one in regards to our reopening framework. And we have some updated slides, a couple that are a little bit older that started to introduce the process because we're not sure who's seen what as far as our presentations. But this presentation is updated with guidance from the State Department, Montgomery County Department of Public Health, CDC guidelines. We had submitted this plan, which was resubmitted on August 14th. And as I said in all the presentations, we are opening once we determine it's safe to open schools. So all these pieces are being put together. We have schedules ready. They will be sent out September 3rd, we believe, but we will not open until we're ready. We have a capital project ongoing. CDC guidelines and guidance are changing constantly. So we'll continue to update the public on all of our social media and media platforms that we have, but just understand that from the beginning that we're taking this slowly and doing this when it'll be ready and safe for everybody. So we know there's childcare issues for staff. We also know parents have the same issue with getting to work and having their kids in school or having kids in daycare. So we do have options for parents at the YMCA in the Capital District and the YMCA in Johnstown have access and have capacity for more students to attend their program. Slowly and doing this when it'll be ready and safe for everybody. So we know there's childcare issues for staff. We also know parents have the same issue with getting to work and having their kids in school or having kids in daycare. So we do have options for parents at the YMCA in the Capital District. I think and Johnstown have access if you have for more students to attend and doing this when it'll be
just 1 second, sorry.
ready and safe for everybody. So
Share a question that came up regarding what you just said.
Mhm.
Okay. A question came in regarding opening. Are schools going to open if the new high efficiency filters aren't installed and tested by opening day? Also, who signs off on the installation and testing of these new filters?
Yeah, so we have a contract with the company TVS to come in and do testing on the filters that we've ordered, and that's why we pushed out to September 21st for the start date of students. So we're still a month out from that. They have to test to make sure that our air handlers can handle the new MERV 13 filters, and we're waiting on the filters. So our goal is to wait until we have those. We have enough air transfer right now to meet the demands and the guidelines for opening and for the amount of air transfer required for all of our students. So we anticipate with the remote only option to have literally 25 or 20% of our kids in a day. So I think with the facilities and the filters we have now, it probably would be safe to open, but my goal was to wait until we have those new filters. However, they could be on back order until November. We're expected to get them, so I wouldn't want to guarantee that will hold up our opening, but the plan is to have them tested and make sure they work. So there'll be updated guidance on that. And because we're at such a low capacity, I think we'd still be okay to open. But we will give you updates as we wait for that. But very good question. So our remote learning option now has gone over 1,700. I did this PowerPoint yesterday afternoon, and so we're above 1,700. So we've ended that today because we need to schedule classes and to allow our principals at each building level to schedule teacher schedules and really work out where they're going to be each period. So this was an option that was given to families because there was such a demand that parents weren't quite ready to send their kids to school yet. So we provided this, and it's obviously very popular. We've asked people to commit for 10 weeks to this.
Question came up, is there a support group for parents? But our parent forum is currently working something out that will support parents.
Okay, great. So if you could hear that, Nancy, we're working on that, creating that parent forum for support.
Yeah, so we have a parent forum and we're working on creating a system that will be available to all parents to get information and to ask questions regularly.
Good. Okay. So the remote option, each morning they'll have remote interaction with their teachers. For K through 5, the teachers will start at 9:30 with regular students in the building. For 6 through 12, they'll start in the afternoon to have time with teachers. And on Wednesday is our remote only day for all K through 12. So they'll see their teachers throughout the periods of the day, scheduled 9 periods. So they'll get a lot of time at that point with teachers. They'll follow that same schedule as purple and gold. So we're trying to make it as, engaging and as much contact time with teachers as we can. It's balancing multiple schedules. You're balancing a hybrid schedule, an in-person schedule, and you're balancing a remote-only schedule. So there'll be limited time, but we're maximizing it as much as possible.
So based on those options you just gave us, in what situation would the school be forced to shut down and go 100% virtual?
If we reach the Department of Health guidelines, basically, it's if we have testing above 9% in a 7-day period, we are shut down. In Montgomery County, 5 cases is considered an outbreak, is what Sarah Branco explained. So even if we had 5 cases for the county, it would be considered an outbreak, and we might be shut down for that too. So 5 new cases in a week. So we would base it all on the guidance that we're given on the actual data provided from the Department of Health, who tracks all of that. But so it wouldn't be our call; it would be the Department of Health's call.
Our next question was, will there be a health screen app for parents to complete prior to their child going into school, or will the temperature just be taken by parent?
So both. So we have Easy Scan is a system we're looking at. For teams, we have My Family. So there's 2 different programs that we have. Steve Nolan has been working on that, doing a really nice job with it. It's all new software, but that would allow parents to scan their kids and to say that they got the temperature for that and send it in to check in. And then we also have it for athletes as well through My Family. It could be used for staff as well. So that's the first level of it, but we do have temperature scanners that are ordered that will be used at every building as a backup, as a secondary measure to have everybody scan that goes in the building as well.
Do you want me to just keep reading them, or do you want to go through it all?
We can answer a couple and then just let Christine go.
All right, so what happens if we're giving the district the benefit of the doubt and sending our kids, and at some point we don't feel safe? Kids are allowed to not wear masks, class sizes feel too large, etc. Will we be able to pull them to online only if we don't feel safe?
Yeah, we were asked that question before. So we've asked everybody to do a 10-week commitment to the remote only option. So a couple of parents have asked about going back from the in-person model to the remote only. And so the concern becomes the balancing of classes, because even though it's a remote session, we have teachers scheduled for those sections. So if they've had 20 kids and all of a sudden there's a push and now it's going to be 35 kids, we'd have to look at it case by case. But I would be more open to allowing people to take their kids out and to do remote only, just because it's not changing the numbers inside the school district. So if you get to that point, please contact me or the building principal first, and then we can discuss it. But those that are doing remote only, we're asking them for that commitment because it would change the numbers in the building, and we're being very cautious of social distancing. But if it's the opposite way out, it's something we could talk about. We'd prefer not to, but I understand the concern.
And other school districts are allowing parents to choose the full remote learning for the entire year. Okay.
I haven't seen that. Most of them that I've seen are usually a 10-week commitment. We also don't know what it's going to look like in 10 weeks, what the situation will look like nationally, locally, how parents will perceive the kids' level of engagement, if students are enjoying it, if people are anxious to get back in the building. So we wanted to do 10 weeks to see how everything works for it on our end and for the teachers and for students and parents. So we don't want to have it be a full year commitment.
That's all I got right now.
Okay, great. Thank you, Christine. You got to click. I don't have to click that. Just hit the side, top, like middle right.
So hi, I'm Christine Smith. I'm the Director of Special Education here for the district. Just some updates to special education. Our special class students will be attending Monday, Tuesday, Thursday, and Friday. That's a bit of a change. Previously, we had said 5 days a week. We're now doing Monday, Tuesday, Thursday, and Friday, so the 4 days a week. On Wednesday, students will have another opportunity, certainly to increase their opportunities for related services. We're going to look at that day strictly for related services. And then any students, certainly who are home, will be engaging in remote learning with their teacher. Wednesday will be an opportunity for both in-person and virtual related services. And again, why the change? We know that early on, we did a survey of special class parents, and there were many parents, over 50%, who were not comfortable with sending their children back. In respect to that, and looking at how best to serve our population, we opted to make that shift based on the feedback we were given. Again, that Wednesday will be dedicated solely to remote learning and related services for all students. Masks. So we know all students are required to wear a mask, both in school and on the bus. If you believe your child is unable to wear a mask due to a medical condition, the first thing you need to do is speak to your child's physician. If through that conversation, you feel that your child, you and your physician feel your child's unable to wear a mask, we ask that you provide that medical documentation to either the CSE office, if it's a special education student, or the building principal. From there, once we have that medical documentation, we can work through the CSE process and update IEPs, or certainly if it's a gen ed student, we can look at providing a 504 plan and looking at different accommodations with regard to wearing a mask. You know, we all know that students need to wear masks. We may be looking at things like increased breaks, just a variety of different accommodations to really help support students wear that mask. Use of one-to-one aids. So a lot of parents have contacted me about one-to-one aids. You know, their child benefits from the support of an aid. They won't be able to socially distance, and we know that. So please be assured that both the student and the aide working with the child will be provided any PPE to ensure the health and safety of both.
I think we get into how much we've ordered and things like that too. That I'll touch on.
Yeah. And again, just that related services to the greatest extent possible. We will respect all the services that are provided on a student's IEP. All efforts will be made to push into academic classes and provide those services rather than pull them out. Again, we know that academic period is limited. We have reduced that. So just kind of supporting that and ensuring that students receive that instruction as well. CSE meetings. April 1st, I think we started, there for a second. April 1st, we started providing CSE meetings. We were in annual review season, and we started providing meetings remotely via Google Meet. We've seen a great response from parents, and so we're going to continue that moving forward. Just some follow-up reminders. Please make sure that we have current information, emails, phone numbers. That's super helpful to us. You'll receive an email. You'll receive an invite via email and or in the mail. That information for the login will be included on that invite. If you have questions on that process or you're not familiar, certainly you can reach out to the CSC office or the case manager, and we can help you through that process. Evaluations, again, our timeline has not changed. For initial evaluations, we still honor the 60-day. There is no waiver for that. Evaluations are being completed in person. Any PPE any personnel that's involved will certainly wear the appropriate PPE. And anything else? Again, the masks, anything that is needed to ensure the health and safety of both the staff and the students. Oh.
You can do skip.
I think I did. Sorry. No.
Wait. I'm sorry. Here we go.
Sorry. One.
Changes.
Yep, here we are.
Here, right?
No. Sorry about that. So again, just, in the spirit of everything, and, it's a difficult time and we recognize that. We definitely want to keep that open lines of communication. between teachers and providers, and most importantly, parents and students. So if you have concerns, if you're having challenges, you want to certainly reach out. We don't want you to not feel part of that process for sure. And again, however your child, whatever services may be listed on an IEP, we will work to coordinate those with you and with your child, but that definitely will be a combination of in-person and remote services. Changes to IEPs or amendments. So again, there may be a variety of reasons after discussion with you that there needs to be a change to a student's IEP. This can be completed without a meeting through an amendment. You will receive that written information in the mail. For that change to take place, you need to sign that form. Many of you have seen these before. We cannot accept verbal consent. You can take a picture of that form, the signed form, and email it back to us. We also have a drop box now outside the CSE office, so you're welcome to drop it off there. But until we have that written consent in our hands or in our email, that change doesn't take place. So simply providing us medical documentation or having that discussion is not enough. So that written signature really, really helps that process move forward and makes that change official. You're up.
Okay, thank you, Christine. So a lot of changes there, a lot of work going into that.
We do have some questions that are based on the sanitizing part.
Okay.
We want,
I'm off the hook.
Go ahead.
a parent is asking, how can parents be sure that proper cleaning is occurring and no one's cutting corners? And how do we really know the buildings are being sterilized and sanitized?
I mean, it's the job of our professionals. We have Stan oversees it, Stosh oversees all of our custodians, and they're getting training from Hill and Marks on proper sanitation processes. We've purchased over 80,000 additional dollars worth of sanitation equipment, wipes, sprays, disinfectants, and they're getting training. So I can assure you they're going through that process and take it seriously. If we need to add hours, we will to make sure that happens. We're putting sanitation stations in each one of the classrooms, as this slide says, but you have to trust in the fact that these are professionals that are here for the best, what's best for our kids and our teachers and our entire staff, and that they're going to take their job seriously and make sure. I'm sure we could provide some type of written documentation of what's happening. Wednesday's also that deep clean where they're doing the fogging, which is an additional level of all that. But each night, everything will be disinfected, door handles and that. So we could probably provide that. That might be something to ask Stosh about putting out, like that checklist. That's a good question. So we can put the checklist out of what they're doing on a daily basis. So we're requiring that everybody wears masks throughout the day. It's definitely, we'll have to have short breaks allowed as I'm presenting. It's definitely harder and difficult for teachers when they're going to present all day. So it's something we're going to have to build into the schedule. But students won't be allowed in the building. They won't be allowed on the bus without a mask. So we do have 1,000 face shields. I think we're up to 15,000 masks that we have now, and always ordering more and building that stockpile because we know that students are going to forget. We'll have them on buses. If a student comes to get on the bus, we'll have masks available for them to wear at that point too. But the expectation is that they'll wear their masks throughout the day for the safety of themselves and everyone else. So we've committed a partnership with the Montgomery County Department of Health, who's provided training to some staff, has worked with our administration. We continue to update that program on our reopening plan. In addition, the reopening plan is posted on the website, as are all the PowerPoints that have been done, including this one. So you can find the PowerPoint with any questions you have. If you look back through it later, it is on the website too. Each school will have a designated quarantine room. So if a student is found during our scanning process, so that question was asked earlier, we're asking parents to scan their kids before they get on the bus or before they're dropped off. But in addition, we'll scan at the entrances. If a student's found to be above the temperature, they'll be they can be scanned again to make sure it was accurate. But if they're found to be sick, there's a quarantine spot we'll wait for to get them a ride, work with the nurse, see what needs to be taken for next steps. But we don't want to infect or have the possibility. We also know that there could be common colds and people could have a fever for a number of reasons. So there's a lot to that. So we want to take that in consideration, work with the nurse and see what needs to be done. But we will have a room for those students and staff.
Will we have a full-time nurse in each building, a registered nurse in each building?
Yeah, so that's a good question. We have worked with Nurse Connection, and we have 2 additional LPNs that are going to be used in the district to ensure that we have nursing coverage in all the buildings. We haven't had that, I understand. So we have committed a contract with them. It's quite an expense for the district, but it's an incredibly important component of it. So one nurse will be 3 days a week. The other one will be 5 days a week consistently to be available in the buildings where it's necessary. So it's a good question.
Can a student wear a face shield?
Face shields don't stop everything. So, if they're not comfortable wearing a mask, it's better than nothing. And there's certain case-by-case instances like Ms. Smith talked about, but we would ask that they wear a shield and in addition wear a mask. So it's not going to stop all the particles when they're speaking or breathing. So the face shield wouldn't be enough unless it was a specific instance where they've had a doctor's note and worked with them.
Okay, so we do have several here.
Okay.
Some are for now, and we'll do this. Will parents be informed if their child is in a room with a child who doesn't wear one for medical reasons, a mask or?
Boy, that's a great question because we worry about Health Information Privacy Act is HIPAA. So we worry about HIPAA violations of saying who that student is. We could tell the parents that a student in this class might not. We couldn't name the student, obviously. Students will probably, would probably take care of that talking about it. But let's put that as a question for the attorney because that's a valid question. But we're always very cautious to provide information about health records or anything related to that because it is a HIPAA violation. So we'll post that on the frequently asked questions. Thank you. Contact tracing and COVID testing is all through Montgomery County Department of Health. So anything that happens, Sarah Branco and her team take over. They look to see who they have contact with. They go back, look at logs, look at cameras, look at whatever, who was in close contact with a person that might have been infected, and they take that part over. That is not on the building level or the district.
So I have a question about sending a kid in sick. What do we do about, how are we keeping parents from knowingly sending their kids into school sick, and then they can't get to school to pick them up?
Yeah, so we'll have a quarantine room for kids that are found to be ill at school, and we would want to, hopefully give parents to pick them up. We've had a couple meetings with STA, who's our transportation company, and we've shared the need that, we feel that we'll need buses to get kids home. We've had some pushback with it. We're still working on it. We have a meeting next week with STA again because of concerns of putting a student who's knowingly either infected or just has a fever on a bus with a driver. So there's another layer to it. Our own buses would be an easier process for that, but they're busy doing our special education runs as well. So we will try to get students home using our transportation. We know it's not feasible in some instances, but we would hope first the parents could, then we would work on our own. We don't want a kid who's ill sitting there all day either. So that'll be something we'll work hard on to try to get. And we have a meeting again on Monday with them.
I'm not sure if this is a BOCES program question for special ed or if it's for CTE, but they want to know about their child going to BOCES program. I'm assuming it's CTE. Are they going to be bused even on Wednesdays?
Yes, they are.
Yeah. If you're in a special ed placement BOCES, you will be.
Yeah.
Oh yeah, it must be, right?
Yeah.
It's a CTE program.
It's a CTE,
Yeah.
so they get bused on their regular days, but
Yeah, so and it's if you can see my chart up there, we just had a meeting that Mr. O'Mealy went to with BOCES, with their CTE director, Jade Tragley, Mike DeMezza, and Rich Miles was part of that process to talk about getting the students there. CTE and BOCES are very welcoming of our students that if they're a gold day and they're out of school Monday, Tuesday, Wednesday, they're welcoming to have our students attend that program. They can drive there. Parents can bring them there. We have not worked out busing yet. Our intent is to have busing for those students. It depends on if it's an AM or PM program. One part of it will be easier for us, but our intention is to provide transportation. So as of right now, they absolutely can go on their days off from school. We just don't know if we'll have transportation for sure. And that's why there's another follow-up meeting. So we just met with them yesterday. We have the meeting on Monday. So we'll post those as they go forward. You can also check in with Mike DeMezza, who runs that program at CT at BOCES as well.
So these are about Chromebooks, some questions. A mom is very concerned about her middle school child bringing her Chromebook back and forth in a backpack. Anything can happen. You know, they are middle schoolers.
Yeah.
If they have a Chromebook that's their own at home, can they leave it there and then use a school Chromebook?
Yeah, they can do that. They can leave it home and then use a school Chromebook. Yes. I've talked about this in other presentations with my two kids who are 15 and now 14. One just had a birthday on Monday. One would bring it home every day and be fine. My son would leave it. So I understand that. I see middle school kids leaving it behind, high school kids. So I talked to the building principals. That's going to be a building level decision whether kids will leave them home all the time and just do in-person learning with their teacher and not have technology. But we're also trying to limit materials that kids have. So it makes it kind of a difficult process to say, don't bring your Chromebooks in, but then have other materials. So we're working our way through that. Most likely high school kids and middle school kids will bring them back and forth. I envision that elementary kids will probably just leave them home and use them at home. So.
We do have a parent, and I apologize, and we will address this, that speaks only Spanish, and he doesn't understand what we're saying.
Okay.
So we can ask our
Jackie.
parent liaison
Yeah.
to give him a call and answer any questions that he might have. I took his name down.
Yeah.
I feel bad.
Lo siento, señor. Yo hablo un poquito en español. Cuando yo tengo tiempo, mañana o viernes, yo llamo tú con Jackie. Es posible para ayudar. Lo siento. Okay.
Good job.
Will it be a nurse overseeing the quarantine isolation room?
That's the plan. So we've talked about which staff would oversee that right now. We worked with our attorneys today on that process. More than likely, yes, the nurse would oversee that quarantine room.
What will happen to kids who encourage other kids not to wear their masks and the other kids comply?
Yeah, so I mean, we're following our code of conduct. There's going to be orientation. There's a slow rollout of having students in the building. And the expectation is that principals will put it on kids to understand the importance of keeping each other safe, that the code of conduct will be followed. If they can't follow the rules, it's for the safety of everyone more than it ever has been before. And if they don't follow, they'll be removed from school if need be. We'll address it on a counseling level to explain why it's so important. But if students are continuing to do that, it'll be handled like regular discipline, unfortunately, because we're at another level of safety and importance of this. So we'll make it very clear the expectation is to wear masks and obviously not to encourage kids to take them off.
So if I could just add to that, on our website, there are a variety of resources about wearing a mask, about practicing wearing a mask, about why we wear a mask. So we encourage all parents to engage in using some of those resources to get your child used to wearing a mask. It's certainly different to sit all day with a mask on. We know that as adults.
Mm-hmm.
So, we would encourage you to certainly start, especially our younger students. It's going to be a different experience for them. So, if you could work with us in doing that, that would be great. And if we can help in any way, certainly we will. But there are some great resources on our website that, have some social stories and a variety of different things that will help.
Thank you. All right, we'll get through a couple slides and we'll answer questions as we go forward as well. So our tentative back to school schedule, Thursday and Friday. Students will have virtual instruction at 9th and 10th of September. The 14th or the 18th will be remote learning for all. We have to get our 180 days in. So students will have instruction. And then we start a very small orientation process for pre-K and kindergarten. Individual parent meetings where they'll come in for 15 or 20 minutes where their son or daughter can meet with the teacher and get to know them for that period of time, just the parents and the teacher and the student. Same for kindergarten. And then grades 6 and 9 will also have that orientation and new students too. So self-contained classes will have a date of their own as well. And then as of right now, the plan is September 21st is when we actually start that purple and gold rollout, where that first cohort of students will come into the buildings on that Monday. So as you know, general school information, this is just what I went over. There'll be time for allowing that orientation. Meals will be prepackaged, so meals will either be a deli sandwich, a peanut butter and jelly sandwich, or a salad. It'll be in bags, ready for kids to take. We want that process to be quick. Students in K through 5 will eat in classrooms. Students in 6 through 12 will eat in the cafeteria. They'll have social distancing. They'll be using individual desks instead of tables. And we'll have alternate locations for students with any severe food allergies. Mr. Caprio told me we ordered 17,000 linear feet of tape to put down signage and show 6 feet and show one-way traffic. And so we have a lot ordered to show students where they need to go and keep proper social distancing, just like you see in stores now. Again, I went through code of conduct, same expectations. We actually have an addendum that we'll have at the board meeting tonight that addresses some of the other issues with COVID that would be new for parents and for students. But we're following the code of conduct just like we have in the past. I discussed this before too, so we'll have people taking temperatures at the door, but also we're asking parents to use our scanning process to take temperature at home and then use the app to let us know how that went. Everyone will wear masks and we'll obviously enforce social distancing. We just wanted to show you some lunch times to kind of get an idea of what a day looks like for pre-K through 5th grade. So lunches are divided over 5 periods. So this really allows for time for the food service staff to get lunches out to students in a safe manner. It allows for cleanup in the classrooms, and the same process is basically followed in the high school, that they have 4 lunch periods, looking at maximum of about 130 to 140 students per lunch period. With our remote learning options right now, as high as they are, it'll probably be closer to 100 kids, maybe less. Probably 75 kids in each lunch, really.
Yeah,
so.
and actually there's a question about that. So if their child is uncomfortable being around kids who won't wear a mask, is there a place that they can go? And particularly at lunchtime, if there's 100 kids, particles travel further than 6 feet, but I don't think that's a concern.
Yeah, our numbers are going to be smaller than that. But again, I would say that would be something to have your son or daughter talk to a counselor, talk to the principal, talk to their teacher. If they're uncomfortable, that they can make accommodations for those students. I know my kids, generally, they're in a small school district in Mayfield, but they eat with their teachers a lot. That's up to teachers if they want to allow that, but that gives them a place to go sometimes too. But we can make alternate locations and they can work on that individually, but that wouldn't be required, but something they could do. So Christine talked a little bit about this, but if you have underlying health conditions and you're concerned, parents can contact the building principal or call the CSE office and provide that information. And someone will follow up to get you more requirements that might be, or documentation that would be required. Nancy?
So what if a parent is uncomfortable sending their child for the entire year and they want full year remote? And then we have another one who says, after 10 weeks, will we be able to return to school without all of these restrictions? So we've got.
Right. Okay, so somebody had asked that before as well. So we have not set up remote learning only for the entire year. It's 10 weeks. I'm sure it'll be something we adjust to improve, to hear feedback, just like we started our program and had a schedule which we adjusted. If somebody wants to commit for the rest of the year and we have it, they certainly could. But the other question was if they don't.
So if after 10 weeks and we want to come back and have no restrictions, basically.
Safety first.
Yeah,
that's not our.
Yeah, that's not our call. Like, that's the Department of Health saying no restrictions. If they want to return to be back in person at the end of 10 weeks, they certainly can, and they become part of a purple or gold group. But again, that's going to depend on COVID positive tests in the county, of what our level of return looks like. Could we have more students in? Could we have less? We don't really know. Nobody could predict that. So our schedule is meant to be flexible. And when we get to that point, we'll know it. But students could certainly get back into school at the end of that 10 weeks.
On our website, there's the frequently asked questions, both in English and Spanish.
Yeah.
So please access the website. There's a bunch of different resources, not only to work with your child, but certainly a lot of questions that, we hear commonly asked, we've created. Mr. Nutzel has created a frequently asked question.
And it's in Spanish as well,
and
right?
it is in English and Spanish, and you can find that on our website.
Great, thank you.
I have a couple other simple ones, I think. Bus forms, are they still valid that they filled out earlier in the early transportation doc? Yes.
Yes, yeah.
So child
Bus
care
slips
can
are
be
still-
taken care of. Who will take the staff's temperatures when they arrive at school? Because sometimes
They'll
they're
be
there
screened.
before a lot of them come early, is basically.
Yeah, no, staff will be screened now.
So there's self-screeners, and you'll have self-screeners in them.
They don't have the app as well, so they
Yeah.
can self-screen, right? Responsible adults will be able to do that, but we'll also have screeners at the door as well, so.
And there is a question about, is lunch free for all?
Yes.
We
Yes.
are a 100%
Right.
free lunch district. Doesn't matter who you are, everyone's entitled to lunch and
Yep.
breakfast.
Extracurricular athletics, so this has been a question we've been asked before. We still will have phys ed classes. Interscholastic sports right now are not happening, but sports are supposed to start September 21st. So if a student is participating in remote-only learning option, they're still eligible to participate in athletics if they were to begin. So there's no problem with that. Extracurricular activities are different if they can be done virtually, so we'll work on that. If you have specific questions, you can send them to Steve Nolan, who's our athletic director. Email is there. It's also on the district website. So we talked about the time dedicated for orientation. The lunch will be prepackaged. I think that's a repeat, actually. We changed that one. So I had a phone call with Spectrum this morning. We know there's some families with unique situations that can't get Spectrum Wi-Fi. Hotspots don't work. So I had a nice conversation with a gentleman who's a regional manager for Spectrum. Contact the school, reach out. I've had a few parents reach out to me directly, and I followed up with them. We're working on getting broadband. We're working on getting different types of networks for the hotspots so you can get access. And then a last-ditch effort is a HughesNet, which is a satellite link. It's fairly expensive. I'm understanding it doesn't work that great, but it is an option for those that have no access right now. So these are some of the plans that are offered through Spectrum right now. The school is working directly with them, and we've purchased 100 hotspots that are through 2 different carriers. So hopefully that'll take care of the equity of access. We also have on our board agenda tonight to have 20 Chromebooks at Central Civico, so students can use the lab there. So
Lunch question again. Can students bring their own lunch and their
Yes.
own water bottles? No.
yes, they can bring their own lunch.
Lunch
Water
you can,
bottles.
water bottles were not.
Yeah.
No, disposable.
Not
We have
reusable.
disposable cups.
Yeah, so we're going to have the filtered water systems where you put a cup up to refill. And so they won't use, just like Dunkin' Donuts isn't using refillable mugs, we will have Dixie cups next to that dispenser for students to use. So water fountains, the traditional ones you bend down and sip, they'll be shut off, but the filter ones will be done. So all of our buildings except one have them, and I think we're working on that. We'll provide water if that water fountain doesn't work in that one building, but we have those refilling stations with cups that'll be available. So.
There is a gentleman's been patient. He asked about, is the teacher for online remote teaching the same that they would have in the classroom? Is it the same teacher doing both?
Yeah, I mean,
We're working that out right now.
that schedule's being worked out. So I met with Mr. O'Mealy a couple weeks ago in regards to that when we only had a few hundred on the remote only. And his plan was to have, let's say, a teacher had 5 teaching periods in a day. They would have 3 of in-class students in their classroom, 2 periods a day. Their door would be shut, and they would be teaching students remotely who were home. So it's built into some of the schedules that they did as a draft right now, but we have so many more students that that's going to be adjusted. So they'll be teaching the same content to those students. It won't be as much face-to-face time as it would be in person. That's part of the, the dilemma of it, and it's why it's an option that it wasn't the first option, but it's something the parents wanted. But they will have their teachers teaching the same content to them.
Back to the water bottle. If the water bottle is disposable, can they bring them?
Maybe that's a question for the department.
That we need to ask further.
My instinct would be yes. They can bring a water bottle and then recycle it or throw it out later in the day. But we'll get guidance on that
I'm gonna ask
because
Sarah.
water's been a big issue. We'll provide it. We will have it. Water fountains will have cups, but my kids like to go with it too. So I understand that. We'll put that up in the frequently asked questions. So thank you for that very good question.
Purple and gold. If my child's a gold and I need them in the purple, is there an option to change them?
No, we've had a number of those requests. So those purple and gold was done by neighborhoods, and it was in order for our busing to be as efficient as possible and for siblings to be able to go to school at the same time. So we're really trying to work with parents to make sure that kids in the same household would be going at the same time. We've had a few of those requests in regards to changing, and our numbers are balanced right now in the buildings. And so if we start changing those and allowing for those requests, it's going to throw the numbers off. It'll throw off the social distancing because we'll have more kids in one section. So we're really not honoring those requests right now. We can't. Remote only with those numbers coming in. If we find in a couple weeks that things are off and we can balance by moving kids, I think you'd be contacted. So I would say send an email to the building principal and just say, if it becomes an option, I would like this to happen, but I can't guarantee it. But we're just finishing all of our numbers for remote only. So if that helps in balancing, we could do it, but ultimately we can't throw off the balance by moving kids with all the requests.
If you're remote only, does purple gold assignment make a difference?
No, it doesn't. No, purple or gold doesn't matter if you're remote only. The only thing is you're going to follow the schedule on Wednesday for remote only, just like purple and gold. Everybody will be in the same schedule on that Wednesday, periods 1 through 9.
And parents should expect probably in the next week or two a newsletter coming out from the district with a lot of this information, probably some of it even updated. So keep an eye out for that. That'll certainly be in English and Spanish as well. We'll have, address a lot of the safety things that we talked about, and we can make sure the water bottle piece is included as well.
So elementary, it's a good point. Elementary has a draft schedule already. High school, middle school plan to send their schedules out September 3rd. And as Christine said, we have a draft of that newsletter that covers transportation, covers registration, covers the schedules, the dates, the purple gold. So there's a lot of information coming out, and that will be in both languages as well. So
if your child's bringing a lunch, I have a question. Yes, they've been advised not to bring lunch boxes across the board.
Right.
And we're asking you to bring your lunch in disposable things, not Tupperware little sandwich containers, just so that they're done, they throw it away, and there's nothing for them to carry around and worry about.
Right. And a parent emailed me about that today in regards to having their child likes to bring things that are cold. So the lunchbox has an ice box. It keeps it cold. It's somewhat refrigerated, and they'd like to still have that option. Our guidance has been that we can't have those soft type of things that are coming back and forth from home. If that changes, we'll put that up there. But the guidance we received was not to allow those in. And I understand the problem it creates, the kids that don't want to eat our meals. But I apologize. That's what we're following. If it changes, we'll post that. So
there is some confusion about Wednesday being our deep clean day. That why is only one group getting the deep cleaning before, but it's being deep cleaned every night.
Right. So there's and we've been asked that before as well. So every night the janitors go through and sanitize everything, all hard surfaces, anything that's touched multiple times. The difference is that we're having the cohorts come in. So the group gold or purple will come in first on Monday, Tuesday. Each night, everything's sanitized. All the desks are clean. All the handles are cleaned. Wednesday is when we have a deep clean because a new group is coming in Thursday and Friday. And so that different cohort, we want to make sure that it's a deep clean. It allows us to do it once a week to go above and beyond the regular cleaning. It doesn't mean that it's not getting done on the other nights. And we'll definitely post that checklist of what they're doing.
And I think another question was, why isn't the deep cleaning happening for the purple group, which comes Mondays and Tuesdays?
It will.
It will, because the deep cleaning with fathers will happen over the weekend.
Right.
Or on the Friday.
So either Friday.
It's not just a Wednesday.
Right. It's twice a week. So it's definitely Wednesday and then it's
fathers,
Friday afternoon or early Monday morning or Sunday with the fathers. Yep.
But regular cleaning is taking place.
Yes.
Yep.
Question about the heat in the middle school. We are aware that there's heat problems, but I believe in our capital project that is being addressed.
Yeah, that's been an ongoing thing. And so every 5 years, we have to do a building condition survey. The project that's going on right now is addressing the issues from 2015. There's 3 new air handlers that are going to the middle school. They should be put in by the beginning of school, hopefully. That will address some of the issues by the end of the project, 3 years out. Sorry, but it's 3 years out. The middle school will have all air conditioning in all classrooms. So there's additional classrooms that you'll see this year in the middle school that'll have air conditioning that didn't before, but this takes time. So over the next 3 years, the entire middle school will have air conditioning. We're allowing fans to blow air out of windows, like box fans, but they can't be in the classroom because we've got a lot of questions on fans as well.
Can we be more specific about the foggers and what is in them?
Yeah, we have an SDS sheet, which is a safety data sheet that explains what it is, and we can probably post that online of what that is and what the chemicals that are used in it. Schools have to use green products. We can't use harsh chemicals. We can't really even use bleach. So we can probably post that and explain what that product is that's being done. Thank you.
Yep.
All right, we gotta just say
I know.
one question, so.
And there's just one
more.
a mother who said regarding the deep cleaning that we've said that before, but they it was reported, I don't know, by students, I guess, that the janitors were not sanitizing the rooms during the pandemic before the closure, but
I can't speak to that, but things are being taken up a level. The severity of the COVID-19 is brought up to a new level for all of us. So whatever happened before, maybe or maybe not, I'm sure they took the job seriously, but we're ensuring that that's done now. So
it's much stricter by county health and all of that.
Our plan had to have that in there. Our custodians have gotten training on it. So all good questions. We'll follow up with a couple of those that we don't have specific answers for yet in the lunchbox.
Certainly the questions and answer section.
Yeah, and that'll be updated all the time. So, okay.
It's on the website.
Oh,
All
the
right.
newsletter too.
In the newsletter will be coming out as well. So, thank you everyone for joining us.
Oh, there are some questions on the whatever. I'm on the YouTube. On the other one, there's some questions.
On the Google Meet?
Yes. Oh, we got them. They're similar.
You got 'em?
Yeah.
Okay, good. All right. We thank you for your time. Please continue to send those questions in. They will be answered. And as I stated from the beginning, this, most likely will change as we have to adjust. Hopefully things will stay as close to the same as they can. Schedules will be mailed out in the next couple of weeks. And please keep in tune. Check the website for updates. Thank you.